Let's take a look at the directory. In BioCompass, we use a directory with the tissues, the themes, and some more information about that, how it reacts in the adaptation phase and how it reacts in the regeneration phase. But there's a few things that you need to realize in using the directory. It's not a book of law. Like, it's not carved in stone. You must recognize this theme in these words. It's about a feeling. It is about the feeling behind the words. So the design of the directory is based on system, organ, tissue. A bodily system like the bones and muscles, like the skins, like cardiovascular, based on regular anatomy. What are the system? Each system contains of a couple of different organs. For example, the cardiovascular system has a heart, has blood vessels, and each organ has one or more different tissues. So it's kind of like a tree-like structure based from system, organ, tissue. Sometimes you might find different names for the same tissue. That is a little bit confusing. There's nothing I can do about it, but I try to use as much mainstream terminology in anatomy and physiology to describe the different tissues. Like the renal pelvis, the reference for renal is the same as the reference for kidney. So kidney, the renal pelvis is part of the kidney. So some common terminology that you will encounter is medulla. Medulla just means middle part. The adrenal medulla is the middle part of the adrenal gland. The cortex is the outer part. So the adrenal cortex is the outer part of the adrenal gland. You also saw that in the brain anatomy. You have the cerebrum medulla, the middle part of the big brain, cerebrum, big brain. And you have the cerebrum cortex, the outer part of the cerebrum, the outer part of the big brain. You also see terminology like mucosa, which is kind of the lining of tissues. Imagine a lining in a tube or in a cavity, and the lining is the mucosa. The submucosa is another word that is to reference the tissue that lies beneath the mucosa. So if we have a bag and the inside of the bag is lined with the mucosa, and then we have the air in the bag. So air, mucosa, outside of the bag. The submucosa is lying underneath the mucosa, seen from the inside of the bag. It will, if you look at the organ charts, it will become more clear. But just so you know, there are some generic terms, and at least you know a little bit about their meaning. Like I mentioned, it's not about the words. It is not about the words. It is about the emotion of the words. Focus on the emotion of the theme. Use the words only as a guideline to generate different expressions, different ways of asking of the emotion that is intended to touch with the wordings. So when we look at the communication model, how do we perceive external events? In this case, how do we perceive words? We hear words based on the sounds that we hear. We delete, distort, generalize. We make pictures out of that. We have memories. We have values and belief systems. And we have a prior set of dictionary words that we know. Like, if I'm in a different country where I'm not speaking the language, I can hear the words, but it will not affect me because I have no clue what they're saying. If I have no comprehension of the words, I cannot create an image out of it. If they ask, Rob, do you want to have an apple? and they say something, Rob, do you want to have a risk? I have no clue what it is. So I cannot make an image out of it. So I cannot feel like, yes, I like having an apple, or I really feel like an apple. Even though that example is really simple, at the same time, it can be really profound when you really realize that, for example, a client also not resonates with words that they cannot comprehend or don't have an image of. Like for the chimbrain, we talk a lot about territory loss, territory anger. But if the client cannot resonate with their expression of territory, then they cannot make an image out of it. So that's why it's important to use the words in the dictionary, or not in the dictionary, in a directory, just as guidelines to focus on the emotion that is underneath. It's not the individual words, it's the personal perception of these words. And so you need to be able to create different definitions, different ways of expressing the same feeling that is mentioned in the directory. So let's do an assignment with that. Use the manual to do a location to find the different themes for a specific set of tissues. Write down the themes and write down the tissue type. Is it sponge, jelly, turtle bear, or chimp? And write your personal insights when you read the description of that theme. So first we're going to do a lookup in the directory, and look up the different themes for the different tissues. Write down the theme, write down the tissue type, and what are your personal expressions, personal feelings, personal way of perceiving that definition. Okay, take about 15 minutes for that. Ready, go.
Do you want even more free videos? Just go to free.biocompass.org and we have a ton of more stuff for you.